So I want to now introduce you to our mayor of Birmingham, William Bell. He is our 33rd mayor for Birmingham and has over a 30-year history of service to Birmingham. Starting out as a city councilor, he was the first African-American president of the Birmingham City Council. He's had many accomplishments under his leadership as mayor. I'm going to list just a few of them. Birmingham's receipt of over $25 million in federal funding to implement a redevelopment project known as Hope 6 that transformed several of our housing projects into decent and mixed housing communities. The $10 million Tiger Grant, which helps support our trail system and active living and community revitalization. Securing funding to help rebuild Pratt City area after the tornadoes in 2011. And transformation of Birmingham, really the beginning of a renaissance in Birmingham through several efforts locally, accomplishments locally, including Regions Field Baseball Facility, the Negro League Baseball Museum, Railroad Park, Birmingham Crossplex, the Uptown District, expansion of the Summit Shopping Center, Grandview Hospital on 280, the Barber Motorsports Facility, and revitalization of several of our neighborhoods. He is a graduate of John Carroll High School and the University of Alabama at Birmingham, where he received a master's degree in psychology, guidance and counseling, and he's also received his law degree from Miles College. One of the things that Mayor Bell is most proud of is his accomplishments in highlighting civil rights in Birmingham, getting us on the national map in a positive light around that, and being an ambassador to the rest of the country and the world around civil rights. So we're very proud to have the mayor here. Come on up, Mayor. And I also just want to say I'm very grateful for his help with us around public health as a great public health partner.
Thank you, Dr. Wilson. Good morning to each and every one of you. As the mayor of the city of Birmingham, it's my honor to serve as the #1 cheerleader for the city of Birmingham and this entire metropolitan area. When we came into office some 4 years ago, we looked at many of the issues that this community faced to see what we could do to create a better environment, to create opportunities for us to move to the top of the ladder in positive ways. As you all know, Birmingham and the metropolitan area has not been the area in which we could boast about clean air, clean water, and a number of other things. Oftentimes we were under the gun with EPA concerning our air pollution in the area, our dependency on individual automobiles to get around, lack of a decent mass transportation system, and a number of different issues. But at the top of that issue was our health. Our health from the standpoint of high ratings of obesity throughout the community, lack of facilities to exercise with, lack of access to quality foods, that old saying, you are what you eat. And in many of our communities throughout this area, citizens do not have access to healthy foods. We did not have the facilities or the public environments to support having a healthy community. So my administration, along with the Jefferson County Health Department, Dr. Wilson, and many other organizations, the United Way, UAB, Minority Health programs, we all banded together to see what we could do to improve the quality of health in this area. Some of the things that we looked at from a city standpoint through our partnership of sustainability with UAB and the Jefferson County Health Department was to look at our walking trails throughout the community. You may have heard about a funding that we received through the federal government that we created the Red Rock Trail system. And that system runs throughout Jefferson County from the east to the west. And Birmingham was the principal sponsor of the application to build this trail. And this trail is designed to go through communities to create walking trails, bike trails, and a number of other interesting locations to get people out and moving. We wanted to create an environment to be conducive to healthy eating. And we have many programs to teach people a different way, a new way of cooking. You know, oftentimes when you think in terms of healthy foods, you think in terms of bland foods. But we realize that if you get the proper training, a healthy meal can taste just as good as a meal that might be full of fat, full of salt, full of sugars. And so we've attempted to change the culture of healthy eating in our community. We also wanted to create a safer environment, because people aren't going to get out and participate in the outdoors if they don't feel that they have a healthier community, a safer community rather. And so we're looking at lighting systems, we're looking at ways that we can create a safer environment so that people won't be afraid to get out and have an evening walk or morning walk or any time of the day walk to help keep themselves in a more healthier condition. We also, part of our safety initiative, want to make sure that our communities are clean, because if you don't have clean and safe sidewalks, if your streets are not in the best of conditions, the environment will not be conducive for people to get out in the community and walk and see what's going on in their community and create that healthier environment. We've had a number of studies that have been done working with the IBM Corporation, Rev Birmingham, and a number of other entities. We did a study on what we call food deserts. And food deserts are areas that people do not have access to healthy foods, nor do they have the transportation to get to those locations that do have healthy food. You know, we take for granted that we can get in our automobile and drive over to Whole Foods or go to our local Publix, but there are so many people in our community that do not have that option and that opportunity. Most of them go to a corner, what we call Quick Mart, and there you have foods that are loaded with salt, loaded with sugar, loaded with starches, and it's not conducive for a healthy diet. So we had a study done by IBM to determine what is it that we can do to improve the access to food in our community. And there were a number of recommendations that they made, recommendations to support rebuilding our neighborhoods to be more attractive to decision makers who are looking for places to locate grocery stores, making sure that we do all we can to educate people as to what healthy eating is really all about. But there was one recommendation that they made that everyone rallied around, and that was to create what we call a mobile food market. To that end, we've asked our Health Action Partnership group to come together and formulate a plan whereby we can outfit four buses into food operations, food markets, that will go into the neighborhoods that are considered to be food deserts and bring those healthier foods. And these buses will not only have fresh vegetables and other healthy foods on them, but they have tips and ideas on how to prepare those products, those foods. They will have exercise information that they can give out into the community. So it creates another avenue by which we can educate people and provide the healthy foods that they are so desperately in need of. The other component to that is we will be collecting data, because if you can demonstrate to the grocery store chains that an area is ripe to be developed as a marketplace, and we have the numbers that come from our food truck, then we can encourage more grocery stores to locate in areas that may have previously not been looked upon as being an area that would be profitable for the development of a grocery store. And it also gives us a chance to identify entrepreneurs in the community, because we'll have to have someone to operate these buses. We'll have to have someone who has the business skills to know what the products are needed for a healthier food choice in the community. And so hopefully those individuals that we identify to be the operator of these mobile food markets will also have the opportunity to turn that into brick and mortar businesses within those communities as well. So it's not only beneficial from a health standpoint, but it's also beneficial from an economic standpoint. And the more things that we do to improve the quality of health in our citizens, the better our entire community will be. It will reduce health costs in the community. I know from the standpoint of the city's perspective, we work constantly to get our employees involved in walking, exercise, and doing those things to keep their bodies healthy. We do that not only for them from a personal standpoint, but from a cost to the city standpoint, because all of you know one of the rising costs in our community is the cost of health care. And if we have individuals who are not healthy, if we have individuals who are injured because they don't have the muscle strength, the muscle tone, and all of these things, it causes your health care costs to rise. So it's beneficial to the city and other employees to make sure that we have a healthy workforce. And so we're doing those type things. To that end, we will be meeting on January 8th at 9 a.m. at the Birmingham Crossplex facility to have more dialogue for the healthy task force that we developed to talk about other things we can do throughout the community. Working with United Way, working with Blue Cross Blue Shield, working with other insurance organizations, working with other community organizations to develop plans to make sure that we have all the options on the table to create a healthy, more vibrant community. And so I want to thank everyone who has worked towards that goal. I want to thank all of you who are part of this effort to make Birmingham the healthiest city in America. And we will be sure to continue the dialogue and put our citizens at the forefront at every opportunity. So thank you all for allowing me to have this moment. Thank you.